awareness outreach has been a huge success. I appreciate God for the Bello Foundation for this opportunity that it has given to so many people to benefit. Whenever we come here, we feel elated when we see people excited, and we play our role to help the foundation have an impact within Kontagora and the environment. This year, so many people came. We saw almost 300 to 400 people, and about 50 people were operated for cataract, and so many people had glasses, and others were treated for other eye ailments such as allergic conjunctivitis. We also had some people who had pterygium excised, and they were so happy because their life has been touched.
So most of the patients we saw, most of them are cataract cases, and those who had refractive errors, and those who have presbyopia, that is reading issues due to age, and then those who have lid cysts, conjunctival cysts, chalasia, and then pterygia. So all of them benefited in one way or the other. For those that needed glasses, we gave them reading glasses. For those that had cataract, they had cataract surgery. We had about 50 cases or thereabout. And then for others who had different other cases, like I mentioned earlier, they equally had surgeries and they benefited. And then there are those who came with allergies, conjunctivitis with discharge. We gave them antibiotics and anti-allergic drugs, which they all benefited.
So far this year, we've seen better improvements. It means that a lot of people have actually been reached out unlike previous times when we come. So far, the case scenarios have been the same. However, in this encounter, we've seen lots of women who have shown, who have come to participate and also been reached out to, in particular fibroids, thyroidectomies, ovarian cysts, and even tumors, which we are hoping that they will be sent for histology for confirmation of whether malignant or non-malignant tumor. So basically, this time around, we've seen an outflow of more women than previous years, probably because of the news and that they've seen other people have been.
The most common ailment is mostly in children, that is vernal conjunctivitis. That is children with itching of the eyes. You see the eyes are brown, reddish. Is the most commonest patient that we have.
The Sani Bello Foundation actually flew us in their choppers. We commenced surgery almost immediately that Wednesday. And then we came, everything was in order. Our accommodation, feeding, and everything was in order. And that gave us a good premise to begin our work. So we started that day. You'll be surprised, we flew in from Kaduna, but we were able to do about 50 cases that same day. And we built up, this is the third day, we built up to about 250 patients, which is quite commendable. So everything went well, no casualties, and our patients are doing very well.
So far, between Wednesday and today, we've carried out about 350 to 400 surgeries, and then about 50 eye cataracts were removed. So far, the surgeries have been successful. Patients are calm and stable, and all types of surgeries were done, from thyroidectomies to myomectomies, that's removal of fibroids, removal of goiter, to little surgeries as hernia and appendicitis.
Most of the cases this year are major cases. Like we did over 20 thyroid operations. In fact, the fibroids, we cannot even count the number. And so many cesarean sessions. We did some ectopic operation, and then the other minor one. So the cases this year, over 90% are major cases. And you can see, but with help of God, we were able to execute and successfully, no casualty at all.
We have a lot of patients who came, some with some minor eye problems like allergy, bacterial conch, of which drugs were given, and then also some came with refractive error, especially we call it presbyopia, and glasses were issued out. And then we had some conditions like cataract surgeries. We had like 50 cataract patients, of which the surgery was successful. The surgery was successful, and then drugs were given to the patient. And then some came with some minor conditions like pterygium.
Yes, there has been improvement, especially in the area of orderliness, because the previous years or the previous camps, we had disorderliness, but it's improving gradually. People are becoming aware, and then the security people that are working hand in hand with us are really trying, and they are happy matters. They have really organized, and they are keeping the place orderly. So there were a lot less skirmishes.
The number and the type of cases operated are more of the major cases than other cases that were used to operating on, like appendectomies, myectomies, hysterectomies, and the rest. So I think that's been very, very wonderful. And I think the people of this community should be able to be grateful to Sani Bello's foundation for relieving a lot of masses from their predicaments.
And the experience so far this year is quite good. The issue is just we've had so many cases, and the crowd, we don't really know. There's a slight reduction in the crowd compared to other years, but what from our gathering of information, they said because of these banditry issues, that's why other people from the local places can find their way here. But still at that, we still have a good number of crowd. Those that have those kind of big cases like the prolapse, the thyroidectomy, other cases.
The surgeries have been successful. We thank God for that. We thank God for Sani Bello Foundation. This collaboration has been going on since 2016, where people have been benefiting on a yearly basis. I think for the past 6 years we've been carrying out surgeries in Kontagora maybe 2 times in a year. I remember we were here in November, and here we are again in June. So if you calculate it on a yearly basis, about 1,000 people benefit from this. And it's very important because many people cannot afford to go to hospitals to remove all the ailments they have. And through this foundation, they've been able to access that.
Cataract surgery, averagely what it will take, it depends on where you go, because it depends on the sophisticated machine you are using. For the type of surgery that we do here with Bello Eye Foundation, if you are going to do it in a setting without support, it will cost you nothing less than 50 to 60,000. Other surgeries like pterygium in a normal setting may cost you about 30,000 or 40,000. But other things like glasses too may cost you like in the region of 20,000. You have reading glasses, good one. But with Bello Foundation, it is given free of charge.
Like thyroid, if you come to our hospital, because it's a private hospital in Kaduna, we'll do it from 400 and above. Or we said vaginal prolapse, we can do it from 250 and above. And what we said fibroid, it depends on the sizes. The small sizes, we used to do it from 200, 300 and above, up to 600, depending on the sizes. When we just do scanning, it can be able to. Appendectomy, that is very easy, I think it started from 100,000 and above.
We have cases ranging from 25,000 to up to 500,000, also depending on the area. Performing some like thyroidectomy in Abuja, you have to pay like 1.5 million. So, yes, basically that's the price ranges for the surgeries. The minimum so far you could get maybe 15,000. Yes, so up to as high as 1.5.
Majorly, like the thyroidectomies, there's no case will cost less than 500,000 naira. In some areas, you can even cost up to $1 million naira. Like the woman that we just operated upon the ovarian cyst, this is an elderly woman that has been carrying this for over 20 years. Based on the size and her state of health, they could charge out to 650,000, and it has been done free of charge to her. I think it's something that is not marvelous.
We should make use of this opportunity. It's one of the rarest in the country, so I think they should make use of it. Any small element they have. I'm sure there's going to be another one in November, so I think it's an avenue for them to be reached out to. It doesn't have to be surgical, it doesn't have to be eye or ophthalmology. It can also be normal conditions which we've been providing medications for. So I think the people around should make use of the opportunity to see that they also get health services rendered free of charge.
This is the most hectic year since when we started our collaboration. We normally usually used to come with 18 staff or more than that, but this year we only come with 12 staff from Graceland. That is 3 from ophthalmologists and 9 from the surgeries aspect. We have 6 doctors with only 3 staff. And the challenging is most of the hospital staff did not have our orientation that we give to our staff. Our staff can be able to start work from 6 a.m. to 9 p.m. But actually the government workers do not have that orientation. So you can even see the challenges, and most of the cases we have this time around are major cases. I think we take about general products, we did about almost 2. We did about 20 waiters, and almost, let me say, manitomy, we did about almost 40 something cases. So you can see the major cases. Most of the people came from village, have this illness, but most of them are afraid to come. And when they see their neighbors or their family members come and enjoy this, that is why they used to come out for the surgeries.
I think the people of Niger State should be very happy with Sani Bello Foundation because of what they are doing. If other people will emulate what the foundation is doing for their people, I mean, Nigeria is going to be the best, because as you know, things are very hard for people. You see some of the diseases that people are carrying around. Some of them have been sick for more than 10 years and they cannot get help anywhere. But suddenly they are here without a single problem. They are being operated and drugs are being given. I think it's a great venture. We are very happy to collaborate with Sani Bello Foundation, and I hope we will keep on, and then people will keep on benefiting from what we are doing.
Yeah, this is something I would want them to continue to do, so that the less privileged will continue to benefit. As a matter of fact, so many people were turned back today. Personally, I saw over 7 patients with huge goiters that they would have operated, but because we are leaving first thing tomorrow, we will not be here to monitor them post-operatively, and so many other cases. So we'll defer them to maybe November, when we'll be coming back to do it. So we'll encourage Sani Bello Foundation to continue doing the good work it's doing by assisting the less privileged. And we are also very happy with the organization, which is headed by Dr. Kani, that's the DG for the Sani Bello Foundation. God is doing very much around us and making sure we have the best so that we can operate without any challenges. Whatever demands we make, we meet the demand almost immediately.
So we have booked others, more patients who came in later on. We booked them for perhaps surgeries when next we come.
This year it's just because from my own observation, there's good coordination a little bit, because some people have been here, like the woman I met, for the past 4 times that we've been here, she has been coming. But one problem is people. So there's a little bit coordination, unlike other years that people will shout, you talk to people they don't understand. But at least this year there's good coordination. People are cooperating. You know, when you tell them do like this, they will still, go, so that everybody wants the same attention at the same time.
This outreach, it has been a lot of experience. We have been coming, we have been partnering with the Sani Bello Foundation to work during this outreach. It has increased our experience, being the forefront members in attending to emergency. Secondly, from what we're hearing around from various beneficiaries, they have been praying for the owner of this foundation because it has helped them in one way or the other.
I met a man who is crying, praying for Sani Bello Foundation and Grassland, because he told me for about 51 years he have had trust, but he don't have money to go for this issue. But for now he has been operated. And for this woman, she has been crying all night long. But for this program when we come, she is one of the beneficiaries at the first day when we started. So all joy in her heart when you see her. Yeah, she was 80 years old. We removed the fibroid and we took a scale to weight it, and it has given us 5.2. You can see even a baby that can be delivered normally or even under cesarean section usually used to come 3.2, 2.7, 2.8, 3.1. That is the heaviest or the most biggest you'll be able to see. But at the tail end, look at this one, it's a fibroid. So she have a very good relief, because when she came, she was walking, she was crying. She was thinking that it cannot be done. But successfully we have done it. We removed the fibroid that reached up to 5.2 kg.
The doctors have been wonderful, and the beneficiaries also been very grateful. They're actually showing their gratitude, because many of them will have to pay thousands to get what they are getting free of charge here. Everything here is free of charge, so they're not paying anything. And I think so far so good. It has actually been a success.
There was an incident of a woman that had been carrying fibroid for over 40 years. She's about 70 years old now. It was actually a community people that had to, the boys, young men, they had to come together and force her here. And the operation was performed, it was successful. And imagine a woman carrying that kind of, and if you see how big the fibroid was, imagine her carrying that for over 40 years. And relief came to her today.
We would like to thank the foundation, the Sani Bello Foundation. What really motivated us was two factors. The first one is we came through a flight, and then the second one is the security that has been put in place for us. That's why we had our minds at rest, and then we came without any fear.
Well, we really appreciate God for the life of our father, Sani Bello, for what he's actually doing for the people, and then we also appreciate the foundation also for their sacrifices for this very program. Yeah.
He's doing a great job to the community, because most of the people that are benefiting from this program, most of them don't go to the hospital. It's when they have of this, they heard of this program of the foundation, is when we start to see them in multiples to the hospital. So I think we have to give him kudos for the job he's doing to the community.
The people are so wonderful. They work as a team, they work as a family. No one showed any sign of tiredness or any kind of identity attitude, say it is on my property, but they embrace the whole foundation as their personal property. I think they are doing marvelously okay. We should praise the Sani Bello Foundation. They are doing very, very okay.
It's all about humanitarian services. They've really done well. They've really done a lot. I was talking to somebody that a surgery of 300, 400,000, they do it for you for free, give you drugs for free. It's something that can never be compared. So truly it's a good one, and we pray for more grace, we pray for more open doors, so that this program will continue.
We are happy because it's what we like doing. It's like a working holiday. We've been here now, this is the 4th day. It's like a working holiday. We are out of our schedules, out of our environment, away from our families, just to come and do this service. So we want to thank Sani Bello for accepting to collaborate with us. We continue this so that the needy will always meet their needs.